This is Dr. Kamala Tamirisa, one of the cardiac electrophysiologists with Texas Cardiac Arrhythmia in Dallas.
I'm Dr. Annabelle Volgman. I'm a professor of medicine at Rush University Medical Center.
Kamala, could you just talk to us a little bit about disparities in healthcare?
Absolutely. It's a very relevant question because there are a lot of disparities in the access to care and the disparities in also outcomes. Several articles have been published in this space looking at the severe maternal morbidity and not just focusing on the mortality. We all got to remember that morbidity is about 50 to 100 times higher in non-Hispanic Black women. And this risk actually starts even the pre-pregnancy. The risk is there. So that's where we can intervene and focus on the preventive measures. And of course, that risk continues during pregnancy and postpartum. Not only is it purely, non-Hispanic Black women, but we need to tie that to also the socioeconomic disparities. Lower income women have been shown to have higher mortality and morbidity during pregnancy. The third thing I will say, since you use the word disparities, age-related disparity in presentation is important. We got to remember older women over the age of 41 tend to have a higher risk of SVT than the younger women. There was actually a regional study in Massachusetts looking at disparities with regards to starting from prepartum, during antepartum, and postpartum. And they found that there was a 60% increased risk of hospital admission in the year before the pregnancy if women had SVT. This was more commoner in Black women who are pregnant. So the disparities exist, and we all know that social determinants of health just span not only from the disease of presentation or pathophysiology, but more so from the socioeconomic, access to care, bias, and all the other issues we look at in several other heart disease aspects. So I don't think cardio-obstetric space is in silos. We see the disparities. We need to practice keeping those demographics in mind and when we care for our patients. And I'm just going to ask Dr. Volgman, could you add anything more to the disparities before we go on?
Yes, I think there's a lot of information about the African Americans having a high risk of maternal mortality. Interestingly, the Hispanics have less maternal mortality than whites, actually. However, we cannot dismiss the other groups, such as the Native Americans and the Alaskan Natives and the Hawaiian Natives and Pacific Islanders. They have a high maternal mortality and morbidity, so we cannot dismiss those groups of women.